Welcome to Hand Therapy Briefs. My name is Marella Deischer. I'm the founder of Virtual Hand to Shoulder Fellowship. And today I'm going to discuss an article out of the Journal of Hand Surgery. So this comes out of last month's edition. And it caught my eye because we're going to be talking about brachial plexus injury for Clinical Corner in December. If you're not familiar with Clinical Corner, each month VHSF faculty Mike Mueller will present a patient case study from his clinic. So he's a full-time clinician out of the Rothman Orthopedic Institute. And so his case study will be on brachial plexus injury next month. So this article I thought was a nice lead-in into that discussion, though this is a little bit different. So the article is focused on traumatic brachial plexus injuries. The purpose of this study was to gain an initial understanding of body image and satisfaction with upper limb appearance in patients with traumatic brachial plexus injuries. So with this patient population, we know that there's devastating physical and emotional sequelae, but that there's also factors related to pain. They're often dealing with different, varying levels of neuropathic pain. And also the fact that patients do describe difficulty with a negative self-image and social relationships. The study was a prospective cohort study. 60 participants completed a satisfaction with appearance survey, which was modified for brachial plexus injury. This survey encompasses 3 major domains. The first one is social discomfort, and in this case, because of the affected limb. The second one is interference with relationships because of the affected limb. And the third one is related to appearance of the affected limb. The researchers did a cross-sectional descriptive analysis to provide this initial understanding of these domains among patients with traumatic brachial plexus injuries. Ultimately, the study found that 45% reported that they're generally satisfied with their overall appearance, but it was the appearance of the affected hand or limb that created the most concern for them. Patients also reported feeling more discomfort or more uncomfortable among individuals they're less familiar with. So some of the related statistics on that that they found was that 18% of the respondents were uncomfortable around family members. 30% were uncomfortable around their friends. And then 32% being uncomfortable amongst strangers. Another finding was that 25% of patients with these traumatic brachial plexus injuries agreed that their injury interfered with relationships, and 27% felt that their injury was unattractive to others. So the conclusions of the study was that almost half of the patients who have had traumatic brachial plexus injuries in this study confirm that they have dissatisfaction with the appearance of their upper limb, which can then impact their personal relationships. Additionally, patients with these injuries feel more uncomfortable in unfamiliar social surroundings. And they also found that it would interfere with how they feel they're being perceived by others. The clinical significance of this really related to counseling and looking for opportunities for the care team when they're working with this population to include counseling with this consideration. So I think, with regards to what we do as PTs and OTs, I think both professions recognize a more holistic approach, a biopsychosocial approach to care. And for OT in particular, because I'm an occupational therapist and I know my profession obviously very well, that's always been part of our approach to care, thinking about social, psychological sequelae, for patients with whatever challenges they're being faced with. So in my practice, being a hand therapist, my focus is on physical disabilities, but of course, OT is a very broad profession, and we work with a lot of other types of impairments as well. So attention to some of the psychosocial barriers is typically a consideration in the development of our treatment plans. And I will say, I'm seeing this with physical therapists as well. If we think about chronic pain and the management of chronic pain, it's recognized, that we need to take more of a biopsychosocial approach. And so strategies that I could see kind of translating well to this population would be like a cognitive behavioral therapy approach, particularly given the fact that they are probably dealing with some degree of neuropathic pain, and then the combination of the way that they're perceiving, the way that they are being perceived. Acquiring a physical disability is challenging. When you're acquiring a disability, especially one that's visually obvious, you don't have the social skills to navigate that. So I think that that's something important to recognize when we're working with these populations versus someone with a congenital um, uh, physical disability because they've developed hopefully also kind of learning how to navigate the barriers that can be there with physical disability, both socially and just even the physical environment. For someone with an acquired disability, this is just another area that we should include in the rehab process. But I really thought the article was great. And again, a great segue into next month's discussion on brachial plexus injury. For Clinical Corner next month, this is actually something we've opened up to anyone that's interested in attending. So if you'd like to link to join that, my email is marella@virtualhandfellowship.com. Email me, I'll send you the registration link for that. You can also find it on the events page of the website, virtualhandfellowship.com. So attend, see what Clinical Corner is like. You don't have to be a fellow. If you're interested in these monthly sessions with Mike Mueller, you can also be a member. And then you can attend these live interactive sessions. And at the end of the year, get contact hours. So if you're a certified hand therapist, the membership offers that opportunity, as well as a lot of other guest speakers that we've had over the past several years. So thanks so much for listening. And if you have comments that you want to add related to the article or brachial plexus injury in general, feel free to do that. Thanks again.